Hello and welcome. Let me start by apologizing for those that haven't seen my videos for a while, and also to thank everyone that sent birthday wishes. Thank you very much. I appreciate and I wish everyone well. Today, I'll be speaking to us about melasma, also called cloasma, um, mask of pregnancy. So, I think you would have some idea of where we're going with this. So, cloasma or melasma, referred to as mask of pregnancy. Of course, when you're talking about a mask, you're talking about something that is put over the face. So this is a condition that typically will affect sun exposed areas, particularly the face and other sun exposed areas. It's a harmless condition. It's non-cancerous. It's not painful. It's not itchy, which is good news, but does occur particularly in women that are pregnant. It refers to symmetric, when you say symmetric, that's on both sides, symmetric brown or gray patches on sun exposed face, and hormonal factors and exposure to sunlight, particularly UV light, will be responsible for this. So what exactly happens? We know that in pregnancy, there will be a surge in estrogen, a surge in progesterone, surge in melanocyte stimulating hormone. This leads to hyperpigmentation. What that means is that there's excessive amount of pigment in the skin. So we'll just back up a little bit to explain a few things. Melanocytes are cells that are specialized that produce a pigment referred to as melanin. Melanin is responsible for the color of skin. So if you have an excessive production, the expectation is that you have an increased amount of pigmentation referred to as hyper. Excess amount of pigmentation is called hyperpigmentation. So what happens is that in the course of pregnancy, you have surges in these hormones. And so when this patient, this lady that is pregnant is exposed to sunlight, it triggers melanocyte production. And so at the end point, you have excess amount of pigment production resulting in hyperpigmentation. It is this hyperpigmentation that is referred to as melasma or cloasma or the mask of pregnancy. So it is symmetric on both sides of the cheek, brown or gray patches. So what are risk factors? Of course, exposure to sunlight, family history, darker skin color, thyroid dysfunction. The thyroid gland is a gland that is around the anterior aspect of the neck. Medications such as anti-epileptics, patients that use combined oral contraceptive pills, and use of cosmetics. How do we treat this condition? Firstly, there is no cure. But remember, we've mentioned the fact that it's a benign, it's not a harmful condition, it's non-cancerous, doesn't have a cure. But remember, pregnancy predisposes patients to this condition. Therefore, within a year, within the first year after delivery, there could be spontaneous resolution. However, sometimes you could also have residual pigmentation in some areas, so it may not completely resolve. Other things that you can do, remember we said that trigger is the sunlight, so if you protect yourself from the sun or the sunlight, you'll definitely be able to significantly reduce the progression. And so this is the most crucial step. So how do you protect yourself from the UV light from the sun? Number one, the use of sunscreens. Number two, protective clothing. In other words, use a type of hat that can at least give you some amount of shade. And then you may need to speak with your dermatologist to provide pigment fading agents. Now, this could be lightening agents. I'm not in any way advocating bleaching. Of course, we're talking about something that's caused some degree of hyperpigmentation. And so it's actually proper in place for us to see how we can reduce this excessive amount of pigmentation. So lightening creams, you can speak to your dermatologist, but it's important to clarify that you're using the right type of topical agents. And so we've discussed melasma or cloasma or the mask of pregnancy, basically occurring in women that are pregnant, surge in hormones, estrogen, progesterone, melanocyte stimulating hormone, exposure to sunlight triggers melanocyte production, there's hyperpigmentation. Good news, it's harmless, doesn't itch, no pain, and within the first year, 1 year after delivery, there could be spontaneous resolution. Thank you.